For better or worse, I'm one of the few individuals who are still involved in HIV, who was there from the very first day in the summer of 1981 when we first found out we had these unusual cases of strange pneumonias and cancers in young gay men in the United States.
I had thought initially that this might be a transmissible agent, but maybe it was some toxic substance, some drug or what have you that they had ingested. But then when it became clear that such a large number of individuals on both coasts were getting it, we became rather suspicious that we were dealing with an infectious agent. And then
several years as I spent most of my time taking care of and studying AIDS patients. Those were really the darkest years of my life, of my professional career, because you were like swimming in the dark. You had a disease that were killing otherwise healthy young men who were previously healthy before they got ill. We didn't know what the cause of it was, and we were putting Band-Aids on hemorrhages.
You know, at the very beginning, AIDS was a complete mystery.
Former Centers for Disease Control and Prevention Director Julie Gerberding came face-to-face with the new epidemic as a young resident at the University of California, San Francisco Medical Center.
This was an era when we had to prepare ourselves that our patients were going to die of this disease.
San Francisco, an AIDS epicenter in the early 80s, saw its gay community ravaged.
We're all scared to death. We'd like to know what the hell we're supposed to do here. You know, what should we do? Should we stay home and lock ourselves back in the closet? Or, you know, what should we do?
You can understand the fear when you realize that almost everyone here has lost someone close to him.
I lost my best friend, did you? 4 years ago. He died of pneumocystis pneumonia. And I watched him die. I watched him right, you know, just right in front of me, just disintegrate.
You have AIDS, Chris?
Yes, I do.
How long you had AIDS?
I'm a newcomer, just a couple of months ago.
What is the prognosis?
The prognosis?
Yeah, what's the future?
I don't deal with the prognosis because I find it's not acceptable to me. But the prognosis is probably 5 to 6 months.
Right from the start, we knew that we were taking care of some of the sickest patients we'd ever seen.
You say that 1 out of every 2 people?
1 out of every 2 gay men in the city is estimated now to be infected with the AIDS virus.
Of 70,000 men?
35,000 are probably infected.
Dr. Paul Volberding was a young oncologist when he and a colleague founded the first ever AIDS clinic in 1983, Ward 86 at San Francisco General Hospital.
Numbers grew very rapidly. Dermatologists that I was working with closely at the time said, you know, when there are 1,000 cases in the country, then the government will take notice of this. And that seemed like an impossibly big number. But of course, we quickly went well beyond that, and it took even more cases before the government really noticed.
It's almost like the plague.
Well, it is a plague. A lot of people don't want to use that word, but from where I sit, it's a plague.
Across the country, the nation's largest city was also reeling.
HIV was every day, everywhere in New York. You couldn't escape HIV.
People were getting ill and people were dying. People were petrified.
In any group of people, it was often the elephant in the room. People wouldn't want to talk about it.
And the media didn't address it, and they spoke about it as an acute condition. It created panic.
The diagnosis, AIDS, always fatal. In almost always confined to 4 high-risk groups: homosexuals, intravenous drug users, Haitian refugees, and hemophiliacs. But a virus that may be on the move into the general population.
News of AIDS threatening mainstream America sparked fear, misinformation, and confusion.
And because one theory holds that AIDS can be spread through saliva, life-saving classes are canceled in Coronado, California.
If I get a disease from somebody I come in contact with, I don't know if I'm going to spread it to my family or not, and that bothers the heck out of me.
We're inundated with calls from either companies or individuals who want to know, what are my risks? Can I ride the bus? Do you know where it's safe? Will my dog catch AIDS from eating a bone that my next door neighbor gave him?
Panic and hysteria fueled cruelty and stigma.
It actually even created a lot of homophobia. I think there was a lot of really nasty stuff said about people who are gay because it was really labeled a gay disease.
Meanwhile, those with the disease continued to suffer and die. Some hope came in the form of AZT therapy, but the side effects were often extreme, and lives were on average only prolonged for a year.
United States.
Conspicuously absent was President Ronald Reagan, who didn't make a substantial statement on AIDS until 1987, 6 years after AIDS was first discovered.
Thank you very much. Thank you. Since we don't yet have a cure or a vaccine, the only thing that can halt the spread of AIDS right now is a change in the behavior of those Americans who are at risk. As I've said before, the federal role is to provide scientific, factual information. Corporations can help get the information out. So can community and religious groups. And of course, so can the schools, with guidance from the parents and with a commitment, I hope, that AIDS education or any aspect of sex education will not be value neutral.
Leadership from the federal government came from an unlikely source, a socially conservative Surgeon General.
I'm Dr. C. Everett Koop, the Surgeon General.
Asked by the president to prepare a special report on AIDS, the physician grew increasingly alarmed about the lethality of the disease and the public's lack of knowledge. In collaboration with Dr. Anthony Fauci, Koop directed one of the largest mass mailings in U.S. history. Approximately 126 million copies of Understanding AIDS went out to Americans.
The household mailing of Understanding AIDS is the closest we can come to making something required reading in every American home. The 8-page brochure lays out the Surgeon General's AIDS explanations and warnings in blunt language rare for an official document.
Despite tension with the president and his inner circle, Koop became an outspoken advocate for condom use and early sex education. Other voices from popular culture emerged, driving edgy, groundbreaking campaigns.
I saw a very clear, obvious opportunity to talk about something that was way more significant than what I did in the ordinary course.
After witnessing many friends and colleagues die from AIDS, fashion designer Kenneth Cole launched bold advertisements to wake up the American public and break the silence.
The ads were meant to be provocative. How do I get people to pay attention? Because this is not a subject people were going to seek out. I needed to challenge them to not look away.
Among Cole's most iconic ads in the 80s features an image by famed photographer Annie Leibovitz of some of the world's most famous fashion models.
We surrounded them with beautiful children because everybody loves all children. We don't learn to hate them until they get older and have opinions.
The most effective advocacy, however, came from those most affected by HIV/AIDS. The unrelenting crisis in America gave rise to a powerful movement led by gay activists. Groups like ACT UP pioneered actions that shook the medical establishment and permanently changed medical practice. A turning point was the storming of the FDA in 1988.
Came in, they had smoke bombs, they grabbed control of buildings, They had camera crews, they sold themselves to the media. They were able to get themselves onto the national stage through a very, very deliberate and very savvy strategy of confrontation.
The activists were trying to gain the attention of the rigid bureaucracy, both the scientific rigidity and regulatory rigidity. And they were not being heard. So they became very iconoclastic and very provocative and very theatrical.
It seemed that the approach that ACT UP was taking, which was to politicize the epidemic and try to demand accountability from government at all levels, was really the way to go.
Mark Harrington laid down ACT UP's vision. Accessibility to drug trials and timely access to experimental therapies were matters of life and death. They had little to lose and no time to waste. At first, however, many believed the group's unprecedented strategy of confrontation did not help their cause.
And that turned virtually everybody off. So it worked against them because nobody wanted to listen to them. So it was like a diminishing returns. The more provocative they came, the more people withdrew.
Harrington and other activists, however, were not simply confrontational. They became experts. They educated their membership, and eventually they formed lasting partnerships with government.
We would, in those days, there was no internet, so we would spend a lot of time sort of trawling through scientific magazines and journal articles to find out information. And one of the things that I turned out to be good at was sort of presenting this information in a way that the ACT UP membership could understand, and that helped us to craft more coherent demands or policy requests from the Food and Drug Administration, and then later for the National Institutes of Health and other sectors like pharma.
Their leadership came to the table highly knowledgeable about how the organs of U.S. government in the biomedical sphere operate. And they were able to come forward with very direct, detailed demands and back them up in a way that I think shocked those like Tony Fauci and others who were in leadership positions. They demanded a seat at the table. They demanded to be taken seriously as a constituency, as a population of people living with this terrible disease. That was unprecedented.
According to Harrington, Fauci was originally reluctant to listen to the activists, but eventually the doctor relented and became the first federal official to meet with group members.
And I decided that I was just going to put aside the theatrics, put aside the confrontation, and listen to what they were saying. And if you really just listened to them, what they were saying was making perfect sense, to the point that if I were in their shoes, I would be doing exactly the same thing as they were doing. And since then, we've developed a relationship of trust and collaboration. And it isn't always smooth, we don't always agree, and we disagree sometimes, but it really opened the door to a dialogue that became very, very important, because they had a major contribution to make, because they could see things in a certain perspective that we couldn't see. And it was important for us to see that.
In contrast to the United States, Africa experienced the explosion of HIV/AIDS much later, very suddenly and on a vastly greater scale.
In the late 80s, obviously globally HIV was really beginning to emerge, but South Africa hadn't really grappled with this.
The first antenatal survey shows that 1 woman in 100 in the late 80s, 1 woman in 100 are HIV positive. By the time I'm a pediatrician, 3 women in 10 are HIV infected. So that's how within 7 years, the HIV epidemic just exploded.
Even in 1994, when we had the first democratic elections, I still don't think that we had fully appreciated what was really going to sort of be what was going to unfold in terms of the epidemic and the impact it was going to have on South Africa.
And I accordingly take great pleasure in announcing the election of Comrade Nelson Mandela to the post.
The end of apartheid and the first democratically elected government occupied most of the nation, and little attention was paid to the emerging disease. The surrounding countries also largely ignored HIV/AIDS in the region, as did the international community, including the World Health Organization.
The countries themselves were not ready. There was a lot of denial, stigma, even a belief that HIV would never come to our country.
It was the conspiracy of silence. No one wanted to talk about it. People was scared of each other, and it was a stigma, discrimination. People running from each other, and it was the disease of others.
It's the first lesson we learned that this is a disease that is not visible right away. There was at that time a recognized period of about 10 years between when you were infected and when you got sick. And so it was easy for political leaders, if you like, to deny the illness because it wasn't visible.
Generally, there was just disbelief. When people talked about the fact that there were already over 1 million people infected with HIV, when we talked about projections of possibly 5 million people being infected with HIV, when we talked about this coming wave of illness and death and children being orphaned, nobody really believed it and nobody really took it seriously.
Later, the realities of the epidemic were much too grave to ignore.
By the early 2000s, you couldn't deny. You could see it in the weekend newspapers, the notices about funerals that would fill whole pages. If you went to a funeral yourself, you would walk around the graveyard, and quite often there would be a queue of people waiting to bury family members.
You see, when you ask the question, does HIV cause AIDS? The question is, does a virus cause a syndrome? How does a virus cause a syndrome? It can't. It really, truly, it's necessary. I've been saying to the honorable members, to the people in this country, it's necessary for people to study this question.
Even as deaths reached a visible, massive scale, President Mbeki flatly denied what was happening, to the horror and frustration of those who understood the urgency to act. Over the next 2 decades, an estimated 3 million South Africans died of AIDS.
The former Soviet republics have dissolved the Soviet Union. Boris Yeltsin tells President Gorbachev to resign now with dignity.
In Eastern Europe, another historical transformation unfolded as the Soviet Union dissolved in 1991. Up to that point, the former Soviet states had not yet faced the HIV/AIDS pandemic. However, the chaos and economic collapse triggered by the dissolution of the world's second superpower opened the door for HIV/AIDS.
That started in the 90s. It started after the collapse of the Soviet Union and a huge social disarray, a dramatic economic situation, and a wave of injecting drug use across the region and particularly in Russia.
Russia's epidemic of HIV/AIDS exploded in the late 1990s and early aughts through sharp increases. The slope of the curve was astonishing for the epidemic among drug users.
In the midst of its runaway crisis in the 1990s, Russian leadership refused to approach drug addiction, the root cause, as a health versus a criminal matter. It has stuck to that position for now over 2 decades. Russia today is a global hotspot among the fastest growing outbreaks. Russia's neighbor, Ukraine, would choose an altogether different path. Recently, comparisons have been made between the worst years of the HIV/AIDS epidemic and COVID-19.
We've entered a new plague, the coronavirus, and the parallels are striking. In the United States in the 80s, in Africa and the Soviet Union, Ukraine, a decade later, what did we see? The capacities were not in place to handle this threat. They quickly became overwhelmed. Leadership failed and relied on denial and obfuscation. And historical transformations compounded the response. The end of apartheid in South Africa, the collapse of the Soviet Union, and now, in this plague, coronavirus plague, the strategic confrontation between the United States and China. What did these failures deliver? The disease outstripped our ability to control it, generating a crisis of enormous scale. Luckily, many fought back and changed fundamentally the landscape. Brave public health leaders within the executive branch, those living with HIV and threatened by HIV, activists and advocates, health providers. Today, as our national leaders have abdicated responsibility, who has stepped forward? Governors, mayors, public health leaders within the executive agencies, medical providers.